Good evening, ladies and gentlemen, and welcome to today's NHSN Training Session 1, Establishing Access through SAMS. Your host today is Lisa Barton. And Lisa, please go ahead.
Thank you, Chris. Good afternoon, and thank you for joining us in the first session of the three-part webinar series for NHSN enrollment. Today, we're going to review the process steps for registering in Secure Access Management Services, also known as SAMS. I'm Lisa Barton in the Oregon office with Health Insight, and I have Tim Nelson in the Utah office also with Health Insight. While I'm doing the talking, Tim will be monitoring the chat to answer any questions that come through during the presentation. Before we get started, I just wanted to point out that the presentation slides, materials, and other documents we're reviewing in today's webinar are available for download in the File section located on the right side of your screen. I also want to mention that we recognize some of you may already have your facility enrolled in NHSN that was previously completed by someone. If your facility is enrolled, you will still need to complete the steps discussed in this session if you have not already done so. You will be notified within the next week if your facility is already enrolled and what your next steps will be. Your process for session 2 will be different than those who do not already have their facility enrolled. If you think your facility is already enrolled and have questions about this, you may chat with Tim or contact either one of us after the webinar. Okay, let's get started. The designated NHSN administrator or anyone who is planning to help with NHSN data submission or analysis will need to go through the SAMS registration process. We highly recommend at least 2 to 3 people in the facility be trained and have access to the facility data. However, only one person in the facility will have the role of NHSN administrator. The reason why we recommend for others to have access in addition to the administrator is so they can be alternates to the event that the facility administrator may need an extra set of hands to help with NHSN data reporting, or they are unavailable to enter the data due to reasons such as they leave or are out on leave. The NHSN facility administrator is responsible for NHSN enrollment for the long-term care facility, as well as the coordination of users who will be responsible for collecting and reporting data for that facility. They also manage each user's activities. They can add or delete users for the facility and manage each user's activity, such as reporting, editing, and analyzing data. The NHSN administrator is the only person who has the authority to reassign their role to another user for reasons such as they're planning to leave the facility or there's a change in duties. The role reassignment must be done before the person leaves the facility. We will get into more detail about the managing users and roles in the Session 2 webinar that's scheduled for September 15th. So there are 5 steps that must be completed before a facility is considered enrolled and can begin the NHSN setup and data reporting. Today we're going to review the first 3 steps in this session. Please note that it can take up to 7 weeks to complete the first 3 steps, including the time that it may take to receive your SAMS identification card in the mail. I did want to mention, though, from some people who have recently completed it, if they upload their application that we're going to discuss later in this presentation, they did have a quicker turnaround. So we will go over that in a little bit, but just wanted to mention that to you guys. It can take less than that. It could take anywhere from 2 weeks to 7 weeks average. Okay. Here's a snapshot of the first 3 steps of the NHSN facility enrollment checklist you can use to help guide you through this process. We highly recommend that you print the checklist before beginning the process so you can check off each item that is completed. It lists the estimated amount of time that each task will take, along with links to resources. You may have received the NHSN version, which is similar. There are only minor differences between the 2, such as language changes in some areas and a few steps moved around. Either version works just fine, so no stress if you have either one. The first step to get started is to complete the training. The training includes reviewing 2 presentation slides. The first presentation regarding tracking infections in long-term care facility is an overview of surveillance and reporting. The second presentation regarding getting access to NHSN for your facility is a guide through the enrollment process. This training will outline the entire process for the user and make the process streamlined and efficient. The process should take 30 minutes to an hour to complete. And a total estimated time, it take about 3 hours to complete the step 1 process. Once you have completed the training portion, you will need to print and complete the facility contact information form that looks like this one. Please note that when completing the application, be sure to select both boxes under the NHSN component section where you see the 2 red arrows pointing. You will need to refer back to this form in step 2. It is important for facilities to prepare their computer and email upfront because it may include changing the security settings of your emails so users can receive communication from NHSN, such as changing the spam blocker to allow emails to come through from nhsn@cdc.gov, as well as from SAMS, no reply at cdc.gov. Other options would be to add the CDC as a trusted site to allow for pop-ups when you're on the site. You may need to ask your IT department to help with this step if you have an IT department. If you do not have an IT department and you're unable to do this on your own, Tim or myself will be happy to help you with this as well. You can contact us or email us and we'll give you that information at the end of this presentation. Now that we have reviewed training and computer preparation, we're going to move to step 2. Okay, so let's go to step 2. To register your facility in NHSN, you will need to go to nhsn.cdc.gov/registration form/index. I have also provided the link on this slide here, so when you have it as your handout, you can click on it or you can either manually enter it in. You will be directed to the rules of behavior page that looks like the picture on the right side. If you want to print a copy of the rules of behavior, you'll need to click on the PDF link before you click agree. It is located next to the agree button that you see circled in this picture here. After electronically agreeing to the rules of behavior, you will be directed to the SAMS application. You will need to add your personal information as well as the facility identifier information. This is where you will need to reference the facility contact form we talked about earlier. For the personal information section, it is important for the user to enter the last and first name exactly as it appears on the identification document that you will plan to submit in step 3, such as your driver's license. For the email address, it is the primary way SAMS and NHSN will communicate with you, so it is important to use the same email address for the entire enrollment process. The facility identifier number is the CMS ID, also known as the CMS certification number, or CCN. Some facilities may also know this as a federal ID number or Medicare number. Only one identifier can be entered for a facility. Please contact Tim or myself if you do not have this number. NHSN training dates. This is for the user to confirm the date they completed the training, which will be reviewing the 2 PowerPoint slides we talked about earlier. This is where you see the little red arrow pointing to the date. Okay, so regarding the emails, after the user has accepted the NHSN rules of behavior and completed the SAMS registration page, you will receive 2 emails that was provided in the registration, sent to the email address that was provided in the registration. The first one will be a welcome email from NHSN, and the second email will come from SAMS no reply, and it will be an invitation to register for SAMS access. We recommend that you create a designated folder in your email inbox so you can save any NHSN specific emails. This will ensure that you are able to quickly locate necessary emails when needed for future reference. Now we're going to step into step 3. The final step for SAMS registration is the step 3. From the invitation to register email we just talked about, you will receive your username and temporary password. Scroll to the bottom and you will find a SAMS registration link. Looks like this in the picture where the arrow is pointing to, where it says using the link at the bottom of the SAMS no reply email. Begin SAMS registration. That's the link you will see. You will click on the link or copy and paste it in your browser to be directed to the SAMS website. Please note this link will expire after 30 days you receive it. So once you click on the link, you will be directed to the SAMS page here, and you will first thing you want to do is bookmark the page. or we recommend that at least, either individually or in a special NHSN bookmark folder. When you're taking the SAMS page, enter your username and temporary password and select Login. You will be taken to the SAMS Rules of Behavior page, read the content, and select the Accept button. This is where you will complete the online SAMS registration. Again, the first and last name and home address must match the information on your ID, such as your driver's license. The home address is the address to where your SAMS identification card will be mailed. The reason why you're being asked to include your home address instead of your work address is because the grid card is your personal property and stays with you regardless of change in facility. Saying that, there's also an area to enter the name, address, and phone number of the long-term care facility you're enrolling. Then you will create your own password and be sure to write it down as you will need this for future use. Click Submit and your SAMS registration will be processed. You can expect to receive a confirmation email within 2 to 3 business days. The confirmation email will contain important instructions and a form to complete the identity verification. Scroll to the bottom of the email and complete the applicant section. Then you will need to provide identity verification using one of the options from List A. The list, by the way, is located as there's 3 parts of this page that you see in the very bottom one where it says List A and List B. You have to provide one from each of the lists and make sure all the information on the photo ID contains your current address, which should be the same as the address you entered on your SAMS registration. Once you have completed the application and obtained 2 unexpired identity documents, you will need to take all 3 items to a notary public. They should endorse the application by using their commission stamp and give the application back to you. Okay, once you have that done, then it's ready to be submitted. So you will then need to submit your notarized identity verification application and copies of the 2 unexpired identification documents to the CDC Proofing Authority. The preferred and most efficient method to submit this form is through digital upload, and there are instructions on how to do this in the email that you received. If you are unable to upload your documents, you may also fax the documents. The last resort is through regular mail, as this is the least efficient and can lengthen the amount of time to get your SAMS card. This is what I was mentioning earlier about uploading will be faster. You would get a faster response that way. At least that's how it's been when people have done it that way versus the other methods. Okay. So after the documents have been processed, you will receive confirmation of approval for SAMS access by email, which may take a few weeks. Your grid card should arrive within 2 weeks after the email confirmation. If you do not receive your grid card after 2 weeks from receiving the approval email, contact NHSN at nhsn@cdc.gov. Your grid card will look like the picture you see here on the bottom. So pretty much that's what's involved in the first 3 steps in getting registered with SAMS. So it's going over, doesn't seem too much of a process once it's been reviewed. And like I said, the materials, this slide and the materials on instructions on how to do this are available on the Files section on your right-hand screen. You can just follow the steps. You can also contact Tim and myself if you are having any issues with this. Or if you need additional assistance, we would be happy to provide that to you. NHSN contact information. So I am the NHSN contact for Oregon and Nevada, and Tim is the contact for Utah and New Mexico. However, if it is urgent and you're unable to get a hold of your contact, then you can call the other one. Either way, we'll be happy to help you. And this slide shows the references and resources where we retrieved our information. The CDC, the link there under presentation materials retrieved. There's a lot of good information there. Available resources, also a lot of good information there to help you with the training. There's also an NHSN demo that you can look at. So a lot of good resources here to help you as well. Okay, so You're going to receive an evaluation within the next 2 days by email. We're going to email you directly, so we appreciate if you just take a few minutes out of your time just to complete it, just to help us ensure what we're doing a good job, or if we need to make any improvements. We greatly appreciate your feedback. So now we're going to go to questions. Tim, are there any questions in the chat that you would like to review?
No, not this time. I did get one chat through email, but other than that, no other questions.
Okay, Chris, we're ready to open the phone lines for questions if anybody wants to talk.
Okay, certainly, ladies and gentlemen, if you have any questions or comments at this time, please press the number 1 key on your phone. Again, if you have any questions at this time, please press the number 1 key on your phone. Okay, we have no questions at this time.
Okay, great. So again, if you guys do want to follow up or need additional help, Tim and I are always here to help you guys. And you can call us or you can email us. Either way will work. And we're going to follow up with you. We're going to send you a follow-up email probably in early September, like around September 2nd, to see what your status is, because we would like you to be registered with SAMS before our next webinar, which is September 15th. That's going to review session 2. So yeah, you guys will be able to get this done by that point. But again, if you're struggling, having issues for any reason, please feel free to reach out to us. Thank you very much for attending, and we really appreciate you participating in this. Thank you, and have a nice day.